Hi beautiful people, welcome back to the channel. It's your girl again, Hetty here. As you can see, I'm all glammed up in pink. It's Pinktober, it's Breast Cancer Awareness Month. We are trying to create all the awareness that we need to create. So without much ado, I'll jump right in. I'm going to give you all the facts that you need to know about breast cancer. If you are ready, let's jump right in. Alright, so breast cancer happens when breast cells mutate to become cancerous cells and then also divide and multiply itself through the milk duct. You know, breast cancer is the second most diagnosed cancer after skin cancer in women, and breast cancer can be fatal if it goes unchecked. So you'd want to take all these things into consideration. I'm going to give you all the fact that you need to know about breast cancer. All right, so statistics have shown that breast cancer is mostly diagnosed in middle-aged and then older women as well. You know, research has shown that women between the ages of 45 to 54 make up about 20% of new cases, whilst 54 to 74 make up about 50% of new cases as well. So I'm going to give you all the facts that you need to know about breast cancer. So number one fact that you may not know is that breast cancer doesn't always come in the form of a lump. You know, you rather want to look out for other signs and symptoms that I'm going to give you later on in this video. So one is that breast cancer doesn't always come in the form of a lump. Number two is that if you've had a male relative who's been diagnosed with breast cancer, your chances of you being diagnosed with breast cancer are relatively high, especially if the relative is a son, a brother, or even a father. So you'd want to also take note of that. So number three is that maintaining a healthy weight will reduce your risk of getting breast cancer. So you would want to stick to plant-based diet, incorporating lots of vegetables and fruits into your diet to maintain a healthy weight. All right, so number four is that you don't need to learn how to do a self-examination like it's being preached out there. Rather, research has shown that you would rather want to stay aware of how your breast looks and feel and report immediately to your doctor if there are any changes in the breast. So number five is that drinking several glasses of alcohol can actually increase your risk of getting breast cancer. You would rather want to play it safe by sticking to the recommended dose of a glass a day for a lady and then 2 glasses a day for men. You don't want to go overboard and drinking excessively. If you do so, your chances of getting breast cancer or being diagnosed with breast cancer are relatively high. All right, so these are the 5 facts that you may not know about breast cancer, so you may want to take them into consideration. All right, so what are some of the risk factors of breast cancer? Number 1 risk factor is genetic mutation or family history. You know, if you've had a family member, like I said early on, who's been diagnosed with breast cancer, it means that your chances of having breast cancer are relatively high. Number 2 is that if you're a smoker, you would want to stop smoking or you would want to quit smoking, because smoking can also increase your risk of being diagnosed with breast cancer. Also, if you are overweight, you would want to also maintain a healthy weight. If you are obese, your chances of being diagnosed with breast cancer are also very, very high. You have about 20 to 40% high risk of you being diagnosed with breast cancer. Number 5 is that if you are not physically active, you are also capable of being diagnosed with breast cancer. So you'd want to fit in an exercise into your routine to make sure that you're physically active every now and then. So like I said, breast cancer doesn't always come in the form of a lump. Rather, you'd want to look out for a swelling around the collarbone of your breasts or in and around the armpit area. That's number 1. Number 2 sign or symptom that you may also see is that there will be thickening around the breast skin. All right. Number 3 that you may want to look out for is thickening and redness around the breast skin. Okay, that's another sign or symptom of breast cancer. And then number 4 that you would want to also look out for is dimpling around the skin area of the breast. Okay. All right, so another sign or symptom that you may also see is breast warmth and also itches around the breast area. That's number 5. Number 6 is that you feel persistent pain in one part of the breast for a period of time. That's another sign that you may also want to look out for. So let's talk treatments. Usually healthcare providers would do a physical examination, or they will order a mammogram to check for signs of breast cancer, or they may also order an ultrasound of the breast, or an MRI also of the breast. They may also do a breast biopsy. All of these things will help them check for signs of breast cancer. But the main treatment for breast cancer is surgery. All right, so like I said, the primary treatment for breast cancer is surgery, and there are various forms of surgery. There's the mastectomy, which is the total removal of the breast tissue. This is when the doctor removes the whole tissue of the breast, especially if you are likely to be diagnosed again with breast cancer. And then there's also the lumpectomy. Unlike the mastectomy, which removes the whole breast tissue, this one is a common treatment for breast cancer. This one removes cancer cells and a healthy margin of breast tissues as well. The lumpectomy will help you keep more of your natural looking breasts, unlike the mastectomy, which takes the whole tissue out. But you may also need other kind of treatment like chemotherapy or radiation in addition to this kind of surgery. You may also want to take note that healthcare providers most times will combine surgery with any of these treatments, that's chemotherapy or radiation, or maybe immunotherapy, or even targeted therapy. All right, beautiful people, that's about all that you need to know about breast cancer. I'll come again with another informative episode next week. Do well to subscribe, like and share the video, and also comment. Until then, bye.